Well, doctors and nurses are calling on the province to do more over Ontario's healthcare worker shortage after a temporary closure of 2 emergency rooms and the consolidation of staff at another. With more on what it's like working in these emergency rooms, working in this environment, we welcome Birgit Umaigba, ER and critical care nurse. Good morning to you.
Good morning, Mel.
Where to begin? I've been following you for some time on social media, and you are not shy to speak out about what is happening in these hospitals. From your experience, how would you classify or how do you describe what it is like for you day in, day out?
Thank you very much for having this conversation. It is very challenging right now. I have been saying this with so many other nurse advocates for the last 2.5 years, going on 3 years. It's very stressful to be a nurse. I've had days where I actually thought about, is this what I want to keep doing? Just the physical, the mental, emotional stress on my body has been challenging. And I have colleagues really, suffering from PTSD, colleagues who are struggling to find a path just because it's so hard to go into work, not knowing what to expect. The stress working right now is huge, and this is having a toll on nurses.
I can't even imagine what that burnout might look like. But here's the thing, and you've been saying this for some time too. It wasn't just the pandemic. That's putting the spotlight on it. We have had an issue with healthcare prior to the pandemic, prior to what we've been seeing in the last few years with staff shortages. And now this is just escalating with a mass exodus, it seems, of a lot of healthcare workers. We saw this report from CUPE yesterday, a poll of 2,300 healthcare workers harassed, everything from violence, racism, sexual assault. You're nodding here because this is no surprise to you, this report.
Correct. Unfortunately, we're seeing an increase in violence and assault on nurses. I have colleagues that have been assaulted. I have a colleague right now that's dealing with, recovering from a physical assault. She was terribly injured by a patient, and she has actually almost no support from the facility where she was assaulted. People are having to wait 20 hours in the emergency room department, and the frustration is floated on nurses, on personal support workers, on porters, and we are seeing nurses as having to deal with patients who are, angry, and these people are in pain, and waiting in the emergency department for hours becomes unbearable for them, and nurses are there 24 hours. Unfortunately, we're having emergency room departments run with less than half of the staff required to have a functioning unit. For example, one of the hospitals, a very busy ER, which normally sees 300 patients a day approximately, is working with less than half the staff. I'm talking about, nurses. They were supposed to, some days we're supposed to have over 30 nurses running the ER, and we have 6 nurses. So patients are being transferred to other hospitals. They're also short-staffed, and it's just a situation that's out of control. All we talk about is healthcare. Healthcare in Ontario is crumbling really fast, and we don't see, leaders with power doing anything about it. It's quite unfortunate.
Birgit, let's talk about, there is no quick fix to this, but there are some steps that can be taken now to at least help. When we talk about even compensation, that's not even a positive right now to reward even financially those like yourselves who day in, day out are put through such physical and mental stress that, what can be done here to keep nurses like yourself on the job?
That's a very good question because it's not about recruiting nurses. We have a lot of openings right now. It's about retaining nurses. First of all, nurses have been calling for Bill 124, which is a bill that was implemented by the Ford government in 2018 as soon as it got into power to suppress the wages of nurses. So nurses have their wages suppressed at 1% increase a year. We know inflation is at all-time high, about 8%, and we having even MPPs, the Conservative Party, just actually increased MPPs' pay from they're already on the sunshine list, about 43 of them now have an increase of $16,000 each. But nurses, the so-called heroes, have their wages frozen. So Bill 124 has to go. That's a major, major issue. And we're also calling on the government to legislate 10 permanent paid sick days for all workers in Ontario, because this is having a brunt on the healthcare system with the pandemic. People are going to work sick, and we know now we've gone into another wave, the summer wave of COVID-19. More people are going to go to work sick. I have colleagues that are isolating right now, nurses that are isolating without pay. That's not possible during a pandemic. So people are definitely going to keep coming to work sick, and this is only going to get worse. We need to open COVID booster eligibility, and we need to provide more mental health support for nurses. And talking about internationally educated nurses, we've been talking about them for quite a while now. What is the process, that phase to transition them into the workforce? How is that going? Is it fast enough? I don't see them working with me. I don't see them, but there are thousands of them in Ontario. That is the quick way to bring nurses into the system as we speak. And then speak to nurses. What are the solutions? Let us hear from nurses themselves.
That's an important part, is to speak to those who are actually going through it right now. And that is why we wanted to speak with you. Birgit, we appreciate you taking the time. I know you have very busy schedules, so thank you for this. And hopefully let's stay in touch and do this again. Thank you.